which still hasn't been put in place, in the sense there are still no tools yet available to standardize protocols and images that we can say this is what we use to go by. And we also don't have adequate tools for quality control assessment for the portable ultrasound machines. So global standardization efforts will be vital to ensure consistent usage and interpretation across healthcare providers. So there's also the limited scope for complex diagnosis. Like if you have very complex cases and that require, detailed assessment, then it becomes very limited. Yeah, those are some of the current limitations that we have. So what the future directions then mean is that we work on the current limitations. So we have to work to ensure that there's adequate training for the operators or for the people who intend to use these point of care applications. Then we also have to understand that over time, the manufacturers will have to consider expanding aspects of depth and resolution to assist us get detailed analysis. Then there's also the aspect of standardization and quality control, which we also will have to look at, especially by the people manufacturing this equipment. And then we will also have to explore ways in which we can have these machines or these devices assist us assess even complex diagnosis. So definitely the future is bright, because we are looking at aspects of accessibility, versatility, and AI integration, which form a great part in the evolving role of the imaging applications in modern clinical medicine. And I'm sure we all understand how central AI integration has become lately. Yeah. So POCUS is no longer just a diagnostic tool. It's transformative. It is going to help us reshape patient care because of all the reasons I've been able to provide. Yeah. So unless we have contributions into this or further discussions, I think I am done with my presentation. Any questions?
Thank you very much, Esther. My question comes from my last encounter with ultrasound many years ago as a student, because I've never practiced ultrasound. We were told that it is operator dependent, and that has always been disturbing me in my mind, whether ultrasound has what we can call competence stratification. Are you able to differentiate levels of competence in ultrasound between, for example, the sonographer and the radiologist for the purposes of the discussion? Are you able to say that this case you give to this clinician and this one you give to this person?
Okay, so in as far as structure is concerned, we do not have like detailed scopes of stratification where we say this and this goes to this, but we look at it broadly in terms of experience, and also in terms of what you have been exposed to, and also in terms of what you consistently do. So we have sonographers who have predominantly just been doing obstetrics, so to speak, and they have done it for a long period of time or for an extensive period of time. So that means that obviously they are better at it. And so by observing what they do, looking at their image quality, looking at the quality of their reports, looking at the quality of their interaction with patients and all those other things, we're able to say this sonographer or this person falls into this category. For the radiologists, of course, the scope is wider because of the fact that there's the multimodality sort of like integration for them, and they're able to look at it just a little more broadly. So that is a bit different. But so for sonographers, it's mostly related to experience, related to what you do every day, related to your years of experience. So all these things eventually contribute to how we stratify you. They're not laid out structures, so to speak, but like someone who, let's say, is hiring, or someone who, let's say, is observing or supervising is able to tell where to stratify. Yeah.
Thank you, Esther. I think another comment from Mr. Ijalai before another question from Muli.
Thank you. Moderator. I was called by the comment you made about low setting and focus. I think the reality is, yes, that is literature. But on the ground, I think focus is still being discussed mostly in urban areas. I think my village, focus has not reached my village as we speak. And I say this because it is out of this gap that today we see other cadres that are not imaging oriented really taking a piece of this. You find now it is nurses running into it, clinical officers running into it, and many other cadres. And I'm worried that as radiographers, we are not taking the lead. These guys are gatekeepers, the Ministry of Health. And any donor that comes around, today talking of maternal and child health, you know, they introduce ideas that are money-oriented. And this focus, if you're not careful, is one thing that is slowly slipping out of our hands. And therefore, it's a challenge to all of us that we really need to be proactive. It is attracting a lot of attention. And how can we be proactive, for example? We are the experts in this field. We are the ones who know how ultrasound works. The way we can remain ahead of this is that we remain proactive, upgrade our skills, and we actually take that position of being the trainers. So that anytime the nurses and other cadres want to come in, wanapata kwamba sisi ndio tuko mbele tayari. They have to come to us before they get it. Otherwise, I think radiographers, please let us wake up. Let us scan around what is happening. And I'm happy that the ministry presently has developed, although the guidelines I think have not been signed, the ministry recently developed guidelines that will regulate the training and practice of focus. And once those guidelines come out, I assure you that the first thing that I've seen in those guidelines is that we need TOTs, the people who train, the people who will be handling the focus equipment. So please, let us be active and let us take the front seat. Thank you.
Okay, so I also have something to just like add to that, like I'll just chime in a little. The scope of this conversation was to be primarily for sonographers and radiographers and radiologists and, you know, just the imaging techs, because I understand how political it has become to include non-imaging healthcare workers into this conversation. It has become very political. So training has probably not been very well structured. The fact that they are getting into this space without the adequate full-time exposure that we have all had, the fact that training, like I've said, has not been structured, the fact that, of course, they are non-imaging healthcare workers, is making the whole conversation very political. So I limited my conversation to just who we are here. The rest of it, I'm sure we can discuss separately, but it is a very central aspect of POCUS because they are slowly invading in. Even if we won't have the conversation or even if we have it, they are invading or slowly creeping into that space. So like he says, it's very important for the people who are training, so that would be the imaging techs or the radiologists, to understand that there has to be structure in training, so that even if they decide they're going to do that work, they do it well. Yeah, because I feel like ultimately we might not be able to control it. What we can control is what we send out, the information, the training, or the, you know, the resources that we provide. And as far as information is concerned, that we can control. But beyond that point, like we say, let us just safeguard our expertise. Then there's also the aspect of, you know, low resource setting kind of POCUS, and of course POCUS in the hospitals, in the modern settings. Yes, that is true. That still embraces or still has to have the aspect of evolution in it. Yeah, so yeah, that was just my contribution to that statement.
Thank you. I know we have one more question from Muli. Any other? So, okay, so maybe by way of doing it, Muli will ask a question, she will note down, then you ask a question, she will note down, then at least you can answer about.
Thank you, the presenter. I think the presentation was good. Mine is not a question, but yes, I enjoyed what Mr. has said. As a society, we have been involved in the setting up of the guidelines for obstetric ultrasound. We know that our members have been concerned, but let's know that POCUS is here with us. And I know again they are happy that we might be selling the equipment. It's not to kill the radiographers or the sonographers, but what is there is supposed to be a quick decision making for the physician. And it's actually said POCUS is about just a small, a low extension, so that if it's a nurse who is using the equipment or whoever who is not an imaging person, they are able to make a quick decision. And if it's a low resource setting, like a nurse who is in level 1, what will happen is that they are supposed to refer that patient. If they see maybe a mother who needs an ultrasound, then they don't have a sonographer, what will happen is that they need to refer that patient to a sonographer, maybe who is in level 4. Because we know that we have even asked why can government train more sonographers for level 1 and 2. But since it's not possible, I think the interest for POCUS are growing, and especially from the manufacturers. And the business is here with us. So as sonographers is to, or radiographers is to just be on a strategic position whereby these patients are referred, are we ready to give the solution? We cannot sit and complain our profession is being intruded. So we have attended this meeting to develop the guidelines. And I think this is just a start, because the only obstetric guidelines have been developed. And they have actually been launched. What is being waited is the training manual for that. Other people like the specialists for lung, chest specialists, they're also coming up. The cardiologists, we have a focus for also cardiac. So these things are coming in the field. And for our members, just for information, is that we should not complain too much, but to align ourselves with the technology. Thank you.
Thank you, Muli.
Thank you, Captain. Mine also is just to amplify what Muli and Olimo have said, just to bring to our attention that Society of Radiography in Kenya have been involved in developing the guidelines for all podcasts. I think I was also invited in one of the LREP forums, and I was very, very categorical that this is our space, and they are expecting that. That is now the reason why in the primary healthcare we have the referral system. So these other people, their engagement is very limited. So I want us to know that our space is the key one, because we are very much involved. And sometimes, as I said before, that we don't voice them, but in this space we are very much involved in setting out the guidelines. So the reason why, again, we need to have our board gazetted so that we set up regulations. So we are able to regulate practice and training. So this will help us. So moving forward, that's why we are fighting for our space in the gazettement of our board. And in these forums we have involved. So just let us to be proactive. And we have said, don't complain, do something in your forum. Be on the forefront. Don't let your space be taken by somebody else, but prove your worth, and they will listen to you. So every other time there's a forum in the Lake Region Economic Bloc, I'm always invited, and I put our issues ahead. So that's how we shall move forward, and together we shall grow. So we are moving ahead. As I said again, everybody wants a piece of what we do. You look at the orthopedics surgeons, they want to do II. The cardiologists, they want to do all focus. But we are telling them this is our field. They can only complement something. So we are glad that we are going to set up training guidelines. They have already been developed, just signing and then together we go. So we roll them out. Please market imaging. Be a good ambassador as you go. Now all of us here, you are able to affect some 10 others. Then those 10 are able to affect others, and then all of a sudden we shall, the whole country, we speak in the same language. Otherwise, thank you so much for the wonderful presentation.
Thank you, Awiti, for giving us an insight into the multiplier effect. Any comment?
I'd just say thank you very much for having me, and thank you for the insights into the fact that there are actually already ongoing conversations regarding regulations and coming up with standardization protocols for this kind of trainings for focus. I think that would be a very useful step.
Your final comment?
Good morning, all of us. I'm Wasiki, and I appreciate so much for this program. I just want to make a comment or a recommendation about this program. For those who are facilitating, thank you so much. But I want to bring out this statement this way. For this program, for us to feel the beauty part of it is to raise up well-constituted regulations so that we push off any external intrusion that's not well trained, but they are just coming up with some short program certificates that are making this field to be as if it is just a walk-in program. That's not worthy of what we are doing for all those years we've been in training field. So I would request the body that's running this program, please come up with well-scrutinized regulations so that in case of any external intrusion that's messing up with our field or with this program, they can be well taken care of in a negative way, not in a positive way, so that we secure our space. We do not just talk of securing our space, but let's take action. And as we train more people into the field, they will feel the essence of being in this field, because most of the meetings we've been going, we've been being advised that ultrasound or sonography is being taken away by external cadres. So we let it go. I've had several such statements. We let it go. which is not a good thing. The good thing you have in hand, you must have the ways on how you can secure it. So please, the body, assure that you are going to be more tough and more scrutiny on this program, and we will feel the better part of it. God bless us.
So thank you all. I think Santa has come early, maybe through this portion. Thank you, Madam Esther, Mrs. Well, for the invaluable and immense presentation, which you've actually empowered all of us. From the program, we can see there ought to be a presentation from GA. However, it will be originated along the way as the program goes on. So remember your focus determines your reality. There's been a lot of contributions on the floor. So remember, words may inspire, but action is what's going to create the change. So let's be the change agents. As a public show, is maybe 1 Thessalonians 5:16 to 18. Where it says, rejoice always, pray continually, give thanks in all circumstances, for this is God's will for you in Christ. So let's give thanks in all circumstances, and as I've said, I think Santa has come early. Thank you, Dorothea. Thank you, G. So I'll hand over back to Sydney, who will take us through the next program, which I think is a prayer. Then the others will continue. Thank you so much. Thank you all attendees.
I think so far so good. We are breaking for tea. We are late a bit, like 30 minutes. Then after that, our next moderator will be Madam Lucy, who will take over from there. Let's interact. I know we are still working in terms of questions and some of the things that we can be able to take home as we go. So let's break for tea. We take around 30 minutes. That's good enough. We'll be having good time to go through the next two presentations. I think the section we are getting in is where we are getting more congested in terms of keeping time. So let's keep time, interact, know your friend. Don't just stand where you know your people, where you know somebody. Have a chance of knowing someone who is new. So as I told you, we have an advantage that I know each and every one of you. Also, who is here? So, karibu sana. Karibu sana, Esther. So let's go for tea.
Kunini? Ushatai. Iko wapi? At the train. Si tuliomba ikianzia. Nata kwangu na mpaka asubuhi.
So, waeleza watoto maybe chai fulani, alafu washrooms kwenye hoteli ilikuwa imetoka hivi.
Nimeambiwa nimeanza dalili zaidi. Chai ni on your where I'm standing on my right. If you are facing me, is on your left. So it's there. I'm not seeing what is there. Let's go and try and open it. They are upstairs where we are getting in. You'll be able to see the doors are well labeled. In case of anything more, we can be able to interact.
So you want to
Yeah.